All right, administers eye prophylaxis, which is
The
called
eye ointment.
No, it's not vitamin K, it's the,
erythromycin. So they get the erythromycin because erythromycin kills what?
the gonorrhea.
The gonorrhea and the chlamydia type thing, okay?
So they're just like little strips that you just wipe.
No, it's an ointment. You just
ointment?
open it up and
Oh, okay, so
Big
it's
old
like a.
goopy
then
ointment.
it looks
Things
like
like that.
Vaseline. Yeah,
Oh, okay.
it's just an ointment. Okay,
Looks nasty.
vitamin K injections always go, most facilities put them in their left leg.
Oh,
That's just kind of standard, they usually do the left leg. Now that I say that, Payson's changed it to the right, I don't know. But they usually just do it in the left leg so that everybody knows if they have a reaction, it's in that leg, that's what it was. So vitamin K, measures weight and length, you guys know how to do that? Okay, if you've got a baby on a scale, can I measure the baby like this? No, I need the hat off, right? Babies need to be totally naked, or if they already have a whole bunch of tubes on them because they weren't breathing, you need to weigh the baby, and then you'll need to weigh the tubes and the things like that, so you know the exact weight of the baby. Why do we have to be so careful with the weight of the baby?
weight loss.
Because medications and everything like that is based on weight and height. Okay, so then you've got your this. You always do circumference of the head, circumference of the abdomen, and do you do that in inches or centimeters?
Both.
Okay, usually centimeters is how they do it. The length is usually in inches, because everybody wants to know the length of the baby. And they usually, when they do the length, they go from the heel of the foot, and they go down the leg to there. Then they take the leg and go up to here, because you have to make that turn. So this baby's about 22.5 inches. Okay? Okay. Make sure that the mom's bonding. Okay, the fontanelles, you fill the posterior, the occipital. The occipital grows back within 18. Oh, sorry, the top one's about 18 months. Yeah. You're going to fill for caput or a cephalhematoma. What's the difference?
The caput goes over the bones.
And a cephalhematoma
Doesn't cross the
is
suture.
divided by the bone structure. Okay, so you can fill for that, and most of the time you'll be able to see those. But if she pushed for a long time, lots of times you'll fill a caput. Okay, you're going to check for eyes. Molding is when they've got like the cone heads, and that's just the head molding. Within a couple days, that'll be back to normal. Check ears for alignment, patency of nares, sucking reflex, intact palate, Epstein pearls or milk teeth. So,
Have you ever seen a baby with teeth?
yes,
With teeth?
I
Was
have,
it kinda
one of the
creepy?
nurses' baby had them.
Were they pretty, like, exposed?
No, they weren't like really far out, but they were out to where you can see them. When you're filling for a palate, make sure you have a gloved hand, and you put the gloved hand up here to fill the baby's palate. Also, you can check and see if the baby will suck your finger. Take the glove off and get new gloves when you do the rest. Skin tags, where are oftentimes skin tags at?
Behind the ear.
Behind the ears. Hands. They'll get a skin tag here. Sometimes their fingers will be webbed, or their toes may be webbed. Observes quiet movement of mouth for symmetry. Have you guys ever seen Sylvester Stallone? When he was delivered with high forceps, and it caused the Bell's palsy in his face. They damaged a nerve, and so when he smiles, he kind of has that. It was damaged at birth. And so if there is forceps or anything like that, that's something that you're going to want to watch and pay for. See if the baby can suck or if it's got the palsy on the side, okay? Check for the rooting. Lots of times when you're checking and looking at the ears and stuff, you'll see the baby root for your hands, okay? Lung sounds, retractions, heart sounds, blood pressure, I think you guys know all that. Brachial and femoral, you guys know where to find those. Capillary refill on babies, you can pretty much push anywhere on capillary refill. Remember though, the periphery may take 10 minutes, may take an hour for it to get really circulated. So if you're checking for capillary refill, I probably wouldn't check down here on the feet initially. because it's gonna be a little bit. You're gonna check for, put the baby up like this, you're gonna check for the spine alignment, for like the scoliosis and the different things like that, or you're also checking for the, thank you, spina bifida. I haven't talked about that forever.
We just did, that's why we're remembering.
Oh, good. See, you guys are usually way smarter than me.
No.
Yeah. Okay, so bowel sounds, and remember with babies, you guys, the bowel sounds are gonna be so teeny, it's gonna sound like this. Just tiny itty bitty bubbles. It doesn't sound like whoa, when your husband lays down to you next to bed, at night you're going, for real? What did you eat for dinner? Same thing I did? But the baby is just teeny tiny itty bitty bubbles. And you have to, lots of people will go clear over it because it's such a small sound. It'd be easier to use your smaller stethoscopes rather than a big old bell across it. So if you've got the baby stethoscopes, use those. Okay, the reflex, the palmar crease is going to be where? Yep, right across the palm. You're checking for the palmar crease. One crease usually signifies, is called
Congenital.
the simian crease.
Oh,
So it's kind of
simian.
just a congenital, and it could be Downs or other syndromes. The Babinski reflex, okay, ours, an adult that's normally, is what when we do this? Plantar. When we do it on a baby, they go, and it's the Babinski, and it's normal. But if the baby does the plantar and the adult does the Babinski, we're all neurologically screwed, right? Okay, so just so know that the Babinski reflex is a normal reflex for a baby. Tonic necks, dancing reflex, I don't know what a dancing reflex is.
Standing
Yeah.
up, their legs will start.
Kind of looks like dancing.
Okay.
But what's the tonic neck one again?
The fencing
Okay, I got you.
on guard
Okay.
position, right?
Blood glucose sample. If you had to get a blood glucose, the best thing to do is get a heating pad underneath or a hot a warm washcloth underneath the foot to get that. Where do you take the blood glucose at?
On the side of the hill.
If the heel is right here, you go side to side. You make a triangle right there on the end of with the point of the triangle being on the tip. You go on the sides of the triangle, both sides. Okay, and you go in. And you guys, I know it's mean and I know it hurts, but one poke is much better than poking them 2 or 3 times with poor samples. So get a good deep poke the first time, and you'll be able to get a good sample. Okay. Voiding crypto orchid. Oh yeah. Check the baby's genitals to see if both of the testes are down. If they're not, then it's the crypto orchidism.
Chidism.
Orchidism. I don't know what.
Oh, I don't either. Isn't it?
Something like that.
And let's see. Pseudomenstruation in female, you may have a teeny bit of blood, and I've seen that. It's just a tiny bit of blood. Boys and girls may have milk come out of their mammary ducts. That's normal. So they won't usually have jaundice. They could have cyanosis, but jaundice is really, I don't know that I've ever seen a baby born with jaundice. Milia is what?
Little pimples.
Little baby zits all over. I don't know what erythema toxicum or. The port wine stains are like the stork bites. That's what we call stork bites. They're just a little reddish, dark red bite. Not a bite. Dark red.
Abnormality.
No, it's like a birthmark.
Yeah.
Like a birthmark.
I have them on the back of my
Some
neck.
go away, and some of them don't go away. Some of them darken to be more like brown, and some of them stay that red, so you just never know. Mongolian spots look like bruises on the back of babies that are what?
Darker
Darker.
Caucasian. Or not Caucasian,
Not Caucasian.
dark skinned.
Okay, so you've got
They look like bruises.
Polynesians, blacks, not European,
Mediterranean.
Mediterranean, and
Hispanics.
yeah, Hispanics. But what are the Arabs? Like the Arab nations have them too. So
Okay.
darker skinned people with the dark hair. I think that's it. So are you guys okay with that? Is there
Yeah.
anything I didn't cover?
We don't know.